we have you guys are two panelists and you have vast experience. So Louis um, works with TMCG and has been, I think, for the last couple of years, about 5. And then we have Charity Mugasha. So maybe, Louis, you can give us a summary of what you do with TMCG and what that has informed you in terms of, the key principles in building successful tech businesses.
Yes, thank you, Martin, for that introduction. Morning, good afternoon, everyone. From Uganda, East Africa. So, Louis Kamnege, medical doctor, background is medicine, and I've been with the Medical Research Group since 2014. So it's around now going to 7 years, about 7 years. And as a telemedicine and digital health company, I was coming from a typical clinical background where it is a brick and mortar health facility where you see clients physically. And so transitioning into this telemedicine, digital health world was a learning curve because we were still a startup at that time. This is 2014, 2015. And as we shall discuss during this panel or discussion, there's been a lot of transitioning from the kind of finding opportunities that are available to you as a startup, as you continue to grow, the learnings that you get as your business grows, diversifies, or makes you metamorphose into different venture, as we shall discuss. Then also that one attracts different kinds of funding. So I would say what I've learned is that one, you should be cognizant of your future as you're building your startup. It helps you to know how you will evolve as a startup, and therefore being also knowledgeable of the funding opportunities around you, such that you can tailor yourself as a startup or as a business to those opportunities.
All right, Chaz, you've had quite good experience, given the fact that you're not traditionally into tech, and having known a little bit about you, and you started out with pencils and sketchbooks as an architect, and now here you are in the digital space. There should have been some interesting motivation, and your experience must be very diverse. And you work with Andela, and so, and with Andela, the ecosystem is almost all the same, playing with TMCG and, borrowing bits and pieces together. So maybe tell us about yourself and what's been your journey in tech, and then we can maybe, deep dive a bit into a few interactions. So, Chaz.
Thank you for the colorful background information, Martin. Yes, my journey, like I think most people that sort of were schooled and prepared to perform in the industrial era, and then somehow when you finish school and you're ready for the job market, there's a whole new era. I think a lot of people like me, I don't think I'm the only one, had to quickly figure out, okay, things are changing. What do I have to do to ensure that I am still professionally growing? I am still academically growing. I am still nourishing my intellectual curiosity and my ability to perform within this context, within the society that I'm in. I think if anybody's interested in answering those questions, in ensuring that your skills are still up to speed with the times, you'll find that you will have to adopt a tech skill or two, whether you like it or not. Even for our parents, I know, I was laughing the other day. My dad now has a smartwatch, and I'm like, what do you know about smartwatches? And he tracks his steps for the day, talking about telehealth and digital innovations in the medical field. Like, these are people who are in the 60s, 70s, realizing that if I hold a smartphone, if I have a smartwatch, it can help me improve my lifestyle. So I don't have to go to the hospital maybe as often as possible to track my blood pressure and stuff like that. So I think it's just inevitable, whether you I started off as an architect, whether you started off as an architect or as a fashion designer or as a painter, I think it's just inevitable to realize that we're living in a time where it's different. Things are different, and it's adapt or die, literally. So maybe professionally speaking, I felt like there was something missing within my professional pursuits as an architect, and the missing gaps that I was seeking to fill, I found within the tech ecosystem. The tech ecosystem gave me a chance to think bigger and broader than I previously was able to do in the construction industry. And it also gave me a chance to collaborate with so many people, people from healthcare, people from human rights sector, people from education sector. And so my problem solving abilities, I realized, were not tied to just construction and design, but could actually be put to use in so many different fields. And then decided to enhance my skills as a design thinker and a design thinking consultant, where I get to work with individuals that want to become better problem solvers by learning how to ask the right questions. If you want to start a business, but you don't know how to, define the problem to find the right solution, design thinking is a methodology that anybody, regardless of their context, regardless of their experience or expertise, can adopt that methodology and become a much better problem solver, and in turn, a much better business leader. Yeah.
Interesting. So, Louis, let's get some honest conversations here. There has been a boom of technology in the last 10 years, right?
Yeah, yes, true.
This is basically recognized in terms of, in the fintech, you see mobile money came, it was disruptive, right? And then there was a boom of, innovation hubs, this hub, this accelerator, this upskill, a lot of things going around, maybe not aligned, maybe in silos, but we see that fintech globally has registered quite a lot of impact compared to healthcare. But in terms of the technology landscape, what has enabled the boom in the uptake of tech? What has changed overall? Be in the whole sector? Maybe then we can go into the health specific ones.
Yeah.
What is that thing that has really changed? Because the landscape has really changed. What has enabled this boom?
Yeah, that's a very interesting question. And as you have rightly put it, it's not, you can't look at it in the lens of just the technology lens, but I would want to approach and give my perspective or my 2 cents in a holistic approach. I think partly what has, working together in terms of the different players, what has helped to provide this enabling environment that has enabled technology or tech hubs to proliferate or to boom in the last decade, as I've put it, is one, I think, first, the global village, because we are in a setting where I can know what's happening in USA within a second, just going on social media and see what's happening. Or just a phone call away, I can know what my friend in South Africa is doing. So that global village that we're living in, or that we actually started living in from the third industrial revolution taking effect, that is the internet taking effect, has had that ripple effect across the entire globe, with Uganda feeling that impact. And therefore, without a doubt, we had to have that ripple effect coming into our ecosystem as Uganda. And then also, I would also say the education system, true, is still traditional, especially when it, or colonial, when it comes to, primary, secondary. But if you have kind of paid attention at the tertiary level, I would say for the past decade, there has been a liberalization of not necessarily the first degree, but that additional, should I say, that added qualification, where we have seen tertiary institutions like, not like to speak their names, but to categorize them, like where they give soft skills in IT, such kind of institutions are many, not necessarily many, but they proliferated in the last 10 years or so. So we could see a lot of vacists in S6 going for short courses in IT, in computer, and those vacists are now 30-year-olds or 20-something-year-olds, and they had that kind of exposure at that stage. And maybe now that they're in their late 20s or 30s, they have that interest in, they developed that interest in tech, and therefore had a chance to build on. Also, for also a relatively young population. We are a relatively young population, Uganda, and a young population is largely tech savvy, easily adaptable, quick at learning, hungry at adopting trends or trending innovations. So you find that there may be a couple of factors that have played in sync or in tandem that has enabled proliferation of adoption of tech hubs in Uganda. But as you have said, one sector has trended far than others, the fintech, and I think my first point, the global world, where people are not going to work with, where if a tourist is coming into Uganda for security and all that aspects, they're not going to work with their hard cash, but they want to have their wallets remain in Europe and bank accounts remain in Europe, but able to traverse all those borders and enjoy the scenery in Uganda, or the geographies, the nature and everything, and just, be able to transact cashless. So that kind of, that triple effect of other sectors also, the fintech leading, other sectors have to play in, because when this tourist comes into Uganda, he's a human being who needs healthcare, who wants to continue to stay in touch with his or her family abroad. So communication comes in, so healthcare comes in, but also wants to transact. So fintech is providing that seamlessly continuity in access of their funds, but also socially wants to continue to converse or stay in touch with their family or friends. So there was an inevitable, should I say, growth in other sectors, because one sector was already trend setting or trend pacing and leading, and therefore by default, if I was still to continue to compete and be able to have relevancy in this new era of technology, also other sectors had to come in. So I would say, from an implementation aspect, that would be partly, but then also from the policy angle, we need to appreciate the slow but directional, should I say, mandate from the policymakers. Of course, we can appreciate that milestone has been done in terms of the data privacy and protection policy. We are one of the few countries in Africa that have such kind of laws in place. Then also the ministries, having line ministries that foster innovation, because in Uganda we have the Ministry of Innovation, Science and Technology, if I've gotten the name properly. So such innovations have fostered, have helped. Such policies and laws, environment have helped to provide a good environment that allows innovation, that allows technology to grow. Yeah, that would be my submission.
That's really profound. And it really speaks to a number of cost-cutting issues with regard to affecting the technology landscape. Charity, what do you have to say? What has enabled this boom in tech from your perspective?
Well, I mean, when you say what has enabled the boom in tech, it's sort of just an inevitability. Yeah.
That's one maybe.
Yeah, it's an inevitability. It's just where we are. This is, I mean, even the other day, Elon Musk was tweeting about Dogecoin and how never in a million years, with all the economics and with all his experience, would he could he explain why Dogecoin was performing as well as it was? Because it just didn't make economic sense that the market, the people were purchasing and the value was going higher. So there's just learnings on so many on so many fronts for so many people. But I think humans, just as humans, like we are driven by the need to survive. Yeah. And if economics is being driven by this digitalization that everybody speaks of, and you need to survive, you know, we had a pandemic. Yeah. And so even for economies and countries like ours that were still moving slowly but surely, as they like to say in Uganda, slow but sure, we had a lockdown and you had a family at home that you needed to feed, and you had all these demands and people need medical attention and kids are not going to school. Wait, what happens? For the first time, I had a neighbor I hadn't talked to in all the years that I've been living here, knocking on my door and saying, "Hi, what is this Zoom thing? How do I install it on my phone?" And having to explain that, you know, her phone was really outdated. She should probably order for a new phone online and then update her OS and then download the app and how to use the Play Store. So there were people who never in a billion years considered that they would ever need to adopt to a certain way of living, thinking, now I have no choice. And so people have no choice. This is just where we are. Having to run workshops with people that are in Gulu, with people that are in Soroti, in very remote areas, suddenly having to figure out, how does a smartphone work? How do I set up a screen and have all of these people in the village come in one room and put a camera and a microphone for them to be able to address their issues despite the lockdown? So the boom, so to speak, was sort of an inevitability. And maybe now, I know that it's something that we were going to talk about later, is we move on to, okay, so what do we have to do in order to efficiently survive and function in this digital age, which comes down to the skills gap. Yeah. So how many people do we have in the country or in Kampala or in your zonal area that understand, for example, what Dr. Lewis was talking about, you know, things to do with data privacy and protection. What is data? What is privacy? What is protection? Why should I care? Why is it important that Uganda even has an arm that is overseeing that? You know, what is a Zoom call? What is a digital conference? So there's so many questions that come up. And I think one of our most pressing issues right now has been leveraging the gap when it comes to information. Yeah. So these skills that you need to be able to have a virtual conference, to run an online business, it's something that we're not really coming up to speed with, realizing that a bigger percentage of the people that we're serving, of the consumers in Uganda, actually don't understand how these tools work, how these things work. Yeah. So we still need, as we innovate very quickly and we come up with these solutions, whether in fintech or healthcare or edutech, we still need to keep in mind that the majority of people don't even understand what all of this means. So having to teach people about how to utilize these tools, why these tools are important while innovate, I think is one of our biggest challenges right now. But the boom is that we need to survive. So we need to figure that out, to ensure that people are surviving, people are functioning, people are learning, people are accessing healthcare, people are accessing food, despite the limitations that may arise. So yes, your question was very broad, but I tried to tackle it very
maybe
specific.
in a few, why, and this is to you, Louis, and Charity. We shall come to Chimera and Cynthia, who have joined us for this session. What makes it very contentious in healthcare to adopt innovations or technology? From your experience, Charity as a user, yeah, why can't you relate fintech to health tech? Louis as a medical doctor now leveraging tech. What are the contentious issues? Why is it so hard? Because healthcare is left behind. Even agriculture can spiral into taking up all these, but healthcare is quite contentious. What are those blocks that make it very contentious? Just a couple of sentences.
Maybe just to continue, maybe to build up, as I answer your question, I'd like to build up on what I was saying. And again, I'm speaking as a design thinker. Yeah, this is somebody that, typically is helping people define the problems and, problem solve. Healthcare is broad. and the problems that are affecting healthcare and trying to get healthcare aware. I don't know, we keep using fintech as the mode, but why it is very hard to innovate in healthcare, I find that it stems from problem definition. Yeah, because healthcare in itself, you are constantly carrying out so much research, yeah, and then analyzing all of that research to be able to come up with a solution. And then it's also two-facing. So are you trying to solve for the consumer? Is it consumer access? Do you want consumers to be able to easily access healthcare, and do you want it to be more efficient? Do you want it to be more affordable? So there's so many facets, yeah. And I find that a lot of the and the other aspect, if you're not on the consumer end, is definitely now the medical personnel. Do you want to innovate a device that's going to be implanted within somebody's body to be able to improve, I don't know, cardiac initiatives? So there's so many facets to it. And I find that a lot of the people that have the skills to be able to innovate creatively within healthcare just don't know where to begin. Yeah. Is it going to be an information and big data analytics within Southern Africa issue? Is it a data collection issue? So I think if we have more people spending a lot of time understanding what specific problem do I want to address, yeah, like people really skip the problem definition area. Like if you can spend a lot of time to say, I'm going to dedicate all of my research and all of my resources to solve for this specific problem, and I'm going to just capitalize on that, it will be easy. With fintech, it's easy. It's access to money. How do you move money faster? How do you help people access money faster? And then there's different segments. There's going to be the lower income segments. There's going to be the travelers. It's really, really, I think, kind of straightforward. So which is why investors will readily throw their money there, because it's a very clear problem, and the solutions that are coming up are also very direct. People have mobile devices, people have people who don't have mobile devices. How do you access money via mobile money? So it's kind of direct. But when it comes to health, it's to say, I mean, there's telehealth, but there's so many specialists. Yeah, maybe I don't need a doctor to just check in on me. Maybe within the next 5 to 10, 15 minutes, I need a cardiologist. I need ambulance services to come through. So if we can figure out a way in which we can have a framework, we can have a structure that will have different people, that's different problem solvers within this sector, say, I'm going to dedicate my time to just this one area. Is it the consumer facing side? Is it the medical professional facing side? I'm going to dedicate my time and efforts within this one sector, and then define this one problem and solve for this one problem. We might have more advances. And this problem is not specific just to developing countries. The United States is struggling with affordability and accessibility. As advanced as it is, it has some of the biggest budgets annually, but they still are struggling. So how do we then get to segment our problem-solving processes and ensure that we can tackle one issue at a time? Yeah.
Yep.
Thank you so much, Louis.
Yeah. So for me, I want to look at it from. I want to agree with the last bit that when it comes to fintech, it's very easy for fintech to like. There's no other commodity that is being transacted between whichever way you're talking about. So that's why it's very easy. I think it's very easy to innovate around the different fintech applications or tools that have been used. But for healthcare, it's kind of unique. From the provider end, is that healthcare, yes, there will be prevention, care, treatment, diagnosis, but it's not like it's one disease. There is infectious diseases, there's non-communicable diseases, there's mental health, there is feminine, women health, there is, and each of those, one disease, whatever it is, each of those is unique in its own way, that the cause is different, the treatment, sorry. So the cause is different, the treatment is different, medication is different, plan of management, like it's so different that you can't have a single innovation or a single tech innovation that will be that will answer all those questions uniformly. I doubt if innovators in health tech haven't defined their problems clearly. Looking at, from my experience and looking at the innovation, there is, just looking at the Uganda innovations, these innovators have understood their problem and they're just solving that particular problem. But because their solution cannot cut across the entire value chain, as I've kind of highlighted, from prevention, care, treatment, all the entire diseases that there is, they're just solving malaria, solving maternal health, solving social and productive health, solving mental health. You get, like, they're just solving one particular problem and just a particular aspect of that problem, and hence the silos, the duplication, or the lack of scalability and as is, not just for Uganda, but also in other settings. So which I think might go into I think the last aspect of the panel. I would think what we need as health tech innovators is deliberate investment that is not looking at just a single aspect of the problem that you're interested in. If you're, for example, you're a pharma industry, so you're a pharma company that is interested in non-communicable diseases, and therefore you're looking at innovations that help support NCDs and hypertension, or you're an infectious disease funder and you are only interested in HIV, and therefore your innovations are only HIV. So we need to look at the holistic environment of enablers, or the enabling environment for tech innovations, and look at those tools that we know of, mapping your country and seeing where they are, and the digital health things like the digital health digital
Atlas.
health
Atlas.
Yes, and that helps to look at as Uganda in the health tech, where are our strengths, where are our weaknesses, where should we put our investments such that holistically we can achieve this that we're talking about, such that it's not like HIV that is almost at 80%, and then you look at non-communicable diseases at 0%, mental health at 0%. You get, like, it's that inequity of investment has persistently resulted into this lack of visibility of health tech. Because I'm very sure there are certain aspects of health tech that are very far. HIV when it comes to health tech is far, but because we are looking at health tech as holistically, not just as just a domain of HIV, NCDs, or what, and therefore we come off lagging behind fintech. So how can we, with the sector players, push for equitable financing, and therefore have an equal play across the entire domains of health?
All right, interesting. Cynthia Mugabe, are you there? And Chimera.
Hi, Cynthia here. I'm here.
Yes, Cynthia, do you have anything to contribute to this? You can turn on your camera, your video, if you're okay with that. But with respect to, I'm also going to engage you guys. So with respect to healthcare and financing and building successful tech businesses, we have identified issues ranging from financing and then playing catch up. What do you think is affecting investment in healthcare businesses, especially tech businesses in healthcare?
I think especially if we are just looking at the example of Uganda, it's important to note that in Uganda, one of the people that we are targeting with these investments are people who are earning less than $1 a day, people who are living on less than $1. It's important to know that, for example, fintech, people who have invested in these things are actually, they are profit driven. Someone is expecting to make profit from this. But with healthcare, where you have to cater for someone who is living on less than $1 a day, how do you get someone to invest in this? Because we are looking at health facilities that are surviving on mostly donor funds. So how are you going to get people to invest in such ventures, to invest in a health facility that surely cannot sustain the project without a donor? So I think that is where the gap comes in, that with other areas where technology is booming, they're mostly profit driven, that someone is making profit from their investment. But with healthcare, it will be hard for someone to see profit because you have to serve the whole population, including someone who cannot afford it. For example, when I look at the example of mobile money, it's like people were forced to get onto mobile money because we removed the scratch cards. So everyone had to start using mobile money. But now, how do you force people to get into technology with healthcare? Like, how do you get someone who cannot afford it to do you get it? So it's a thing of how do you get an investor to invest in healthcare when they don't really see it as a profit-driven thing.
Yeah.
Yeah.
And I think I can relate to that, because healthcare really, when you front profit, it doesn't create equity. So I don't know, Chimera, do you want to add on to this briefly? You said you can use the chat. I don't know if you're there. So Louis and Charity. So Louis, TMCG has created a shock wave to people who never used to appreciate tech in healthcare. TMCG is not innovating or introducing products from scratch, right? It's not that you built apps or what, but what kind of model did you leverage to adopt certain available technologies into a holistic program to deliver healthcare as a private entity? And what has been that challenge? Then to Chaz, so we understand, yes, innovating for healthcare is a bit hard because multifaceted. There are quite a number of dynamics. What opportunities do we have given that? So Louis, maybe in a minute, such that we can.
In a minute. Yeah, thank you very much for the question. Yeah. So, like you've rightly said, private company, not enough resources available for you to build things out of scratch, or kind of build a unicorn. So what we had to do as a private startup is to leverage existing resources, especially around tools that were already being used by the common person, you and me, to transact or to go about their normal life. So we know that people were staying in touch with each other using WhatsApp or other social media platforms like Facebook, Twitter. We knew that people were calling their friends using their call log on their mobile phone. And also we knew that people were already using SMS for transacting, or mobile money, or even sharing chats. So the idea was staying less competitive in a sense of space on your phone, downloading an app. Why don't we use what is already existing on your phone to access healthcare? And so we came up with initiatives like WhatsApp Doc, leveraging also Facebook to post health information or health content, and generating conversations, and using those as low-hanging fruits to penetrate a population that wasn't leveraging these online tools for healthcare. So in that way, you have less learning curve. The person is not downloading an app. The person is not learning how to, download this. This is how you interact. This is how the doctor, you find them here, click there. So they are just seamlessly using online platforms, but the ones that they already used to now access healthcare. And slowly by slowly, people were appreciating the convenience, the turnaround time, the no-need for movement to access a doctor remotely, and that 24/7 access. And slowly by slowly, you have donors looking at this as an opportunity they could invest in for their target, like how Cynthia has rightly put it, a donor looking at how to a low cost venture that would allow for easy access to medical services, yet without necessarily having to invest a lot. And that's how we, as TMCG, leveraged on those investments at the donor side, and at the same time selling it as a concept that can be used by paying for clients. And hence where we are standing right now, where we have telemedicine being leveraged by private health insurance companies for their beneficiaries to access healthcare via the usuals, a hotline, a chat platform, WhatsApp. But it was right from the onset of same tools leveraged in other settings being now pivoted for healthcare, and hence having that short learning curve and is a buy-in.
So literally, we don't have to start from scratch. Some of the solutions are within us. Chaz, the challenges that you mentioned, what opportunities do we have to build these successful tech businesses, either as private entities, collaborative entities? Because healthcare, one thing I've realized, is not disruptive, it is transformative. As you've realized, it's not a linear transaction as is with fintech, because fintech is an exchange. Healthcare is not an exchange. So those gaps, what opportunities do we have for innovation differently?
I mean, I think like everybody has been mentioning that the opportunities are definitely limitless. If I was to even start giving ideas, I would, by the time an hour elapsed, it wouldn't end. But I think it's how do we leverage ourselves and the resources that we have in order to access the opportunities that are out there. So how do you prepare yourself? I think the first and foremost, I know, yes, most people seem to say, I know the problem I'm trying to solve. Number one cause of death in Uganda, data has shown it is infant and maternal mortality at the time of birth. So I want to do something around there. And so maybe you spend all of your resources designing an incubator, but then you find that the problem might not be designing another incubator. The problem might be maybe production, or it might be that the incubators that are existing are too bulky, or they are not easily usable by midwives across the country. So when I say clear problem definition, is usually you start off believing that this is the problem, but the problem might be a design issue. The problem might be an accessibility issue. The problem might be a financing issue. Yes, you're a doctor. Yes, you're a pharmacist. Yes, you're a biomedical engineer. And sometimes I find that not just within the health sector, but as problem solvers, we get to be so tied down to this is what I know how to do. I am limited by my skills and my abilities, and this is what I know how to do. And I'm going to make sure that I do it in the way that I know how to do. Please listen to me. But more often than not, with proper problem definition, and this isn't just, again, I say it's not just within the health sector, but I think it's something the health sector can benefit from, is to, if we're talking about, somebody mentioned that a lot of people might not adopt telehealth initiatives, maybe because they think they're expensive, they're profit motivated, but then that isn't really a problem to do with the telehealth medical options available. Maybe it's a marketing issue. So maybe you need to rethink your marketing and communication strategy in a way that the users that you're targeting, the majority of the Ugandans will understand it. There've been so many initiatives, even within fintech, because they've tried and failed so many times, where somebody comes up with an ad, they put out the billboards, and the target audience for their product was maybe a lower income segment, but the people that are using the product are the people within the urban centers, or the middle income segment. So that's a fail. You have the wrong users utilizing your product, and so then the problem then isn't so much about what you designed, but it's about how you communicated what you designed. So problem definition is something that's setting us, a lot of us, back. Yeah, we presume that we know what the market needs, we know what the end users need. But if we start to work backwards and we start to talk to these end users and allow them to tell us what it is that they need, it can help guide our problem solving processes much better. And then secondly, involve the stakeholders, involve the people that you are problem solving for every single step of the way. You know, you have an amazing initiative, you've put in years, you've put in resources, but maybe you're not getting the next round of funding because you can't present impact analysis matrix that makes sense for funders, for donors. Then what do? The thing seemed to work. Everything was working at the start, but we're not really getting the data that we need in order for us to take it to the next step. So you have to take a step back and say, okay, what did we do wrong? Yeah. And again, more often than not, allow the users to inform you, allow the users to guide you. Do they need another hospital, or do they need more home visit doctors? Do they need another application online, or do they just need, allow the end users to guide you? And I think if we all start to do that, whether it is within consumer access to healthcare, or it's midwives in rural settings being able to work with doctors in the city centers as they do complex body scans using mobile devices, whatever way. Are you designing with the end users in mind? Are you directly involving them in the problem solving processes? And are you coming up with a solution that they can also co-own? They can also put a stamp of approval on and say, yes, this is what works for me. This is something I'm going to adopt. This is something I'm going to use. And as we, create future improvements on this solution, I will always be part of that process. I will always be engaged in the stakeholder management, meetings or workshops or sessions that you're holding to ensure that I am getting something that I also need. There's another example that I can use very clearly. We have all of these health insurance players coming into the market, competing big, and all their offerings are very expensive, so they're still all fighting within a very tiny segment of the market, where it is pay giant premiums, and so you don't have to pay anything at all when you go to the hospital. But something that has seemed to work in so many other areas is you have a lot more people in the country paying small premiums, but then maybe co-paying when they go to the hospital. So you have more people being able to access healthcare and planning for it with the little money that they have. Why don't we have more people innovating that way? Because the majority of the people cannot afford to pay, over 100,000 a year for healthcare. That's the reality. So how do you come up and how do you design and how do you problem solve in a way that you will have something that can have more people buying into your solution and utilizing your solution, so it can be a win-win situation for all?
Well, interesting. You really speak of design thinking and how we need to, I think, embed it in all aspects of innovation, right from product processes and having the end user at the center of the discussion. And it's interesting how you propose the different models that can actually work to increase uptake of some of these solutions, and that tech in itself is not a one solution. It doesn't have to be tech. It can be a simple solution like around insurance and how you can model different packages for the spectrum of our population, the low earners, the high earners, but ensuring that everyone gets access to quality health. So that is quite insightful. We have Irene on the call. I don't know if Irene wants to add on anything with regard to building successful tech businesses and ventures for healthcare. Irene, is there anything you want to add on? Or Cynthia?
No, nothing from my side. Maybe I just liked what Charity said regarding the whole creating solutions that cater to every resource setting. I think that's quite interesting. But I think my question would be how, especially, for example, there's been all this talk about insurance, yes, but now we are looking at, we want to merge technology with what is already existing. So how do we merge, for example, how do we merge our resource settings to these ideas that are coming up? For example, with Rocket Health, how are you getting people from low resource settings on board? I think that's my question.
Louis.
Yeah, before I answer Cynthia's question, I want to also add on one thing. I don't know whether on the among our attendants we have person from the government, and I don't know why we downplay the role and the mandate government has to do with all this that we're talking about. Because trust me, with this liberalized economy, leaving everything to the private sector, it will be expensive. Few people will be able to access it. And therefore, we shall come back to the same discussion of why few people, why fragmentation, why no scale. The truth is that now going into an example of what Cynthia has put it, if you look at how, using an example of UK did I'm forgetting the providers, but it has telemedicine as its first point of contact for healthcare, like OPD. So before you go to the EM emergency room, the traditional, like go to the clinic or to the health hospital, see a doctor physically, your first point of contact is telemedicine. But of course, before that, as a regulation or as a rule or as a policy, it was, you could go to your primary doctor or primary physician or wherever you could choose. And maybe there were these small players of telemedicine in silos playing everywhere. So it's the same thing that's happening in Uganda. Until maybe we have the National Health Insurance Scheme on board, where now we know that every Ugandan has national health insurance, irrespective of how they're going to play it. And then a proper packaging of national health insurance. Maybe the first layer, telemedicine. You have this properly well-written process flow or strategy of this is how the national health insurance will be pivoted. Telemedicine at your convenience will be the first point of, and properly equip these hospitals or health providers together with the PPP, like private-public partnership, and equip them to have a telemedicine-supported OPD delivery. And then telemedicine will triage and refer critical cases, whichever mechanism, to the physical facility, and hence you will have these patients or clients that need to be seen physically going to a physical setting. So there is no way we can downplay the role that government has to play in making sure that this harmonization, this scaling, and integration of digital innovations in healthcare has to happen. But now, what is happening now? Like, with Cynthia's questions, how is Rocket Health? How has Rocket Health, or has Rocket Health managed to play in the different spectra of demographics? The rural that is unable to pay for health care but is able to access some form of telemedicine, and then the urban that is able to also pay or be facilitated to pay and access telemedicine facilitated healthcare delivery. So through partnership with donor-funded organizations like USAID-funded projects, you have the rural demographic, that adolescent young woman in the rural area able to teleconsult because they have this toll-free hotline that has been prepaid by this project, and they're able to teleconsult. So for them, the angle, the component of telemedicine that they're able to get is teleconsultation. So they don't pay for the doctor visit. They don't need to walk or trek 10 kilometers to the nearest health center 4 or 3. So they stay in that village in Kabale, but because their project funds them to access a doctor 24/7, they can teleconsult. But they can't get the entire journey of labs or pharmacy. Why? Because the project doesn't cater for that. So the only thing that Rocket Health can do is to direct them to the nearest health facility and refer them. So of course now there's a gap in continuity, and the reason is that I've said, donor funded, and the only mileage they can go is teleconsultation. However, we have managed to sell this concept to private health insurance, and of course we know like how Cynthia has rightly put it. Charity has rightly put it. Private health insurance is largely for the few, mainly the employable population, which is just actually, private insurance will say we only have 1% of the employable population. Imagine. And because also the insurer got a problem, lack of visibility in reconciliation of their premiums when providers come back to claim to make their claims, and also the expensive, should I say, they needed visibility in these claims that providers were giving, and also they needed ability to predict trends, and that it wasn't feasible in the traditional healthcare model, which was paper-based, and claim forms are paper-based. Claim forms take time to be reconciled, and the insurer to know, okay, this month this is how much utilized, and therefore I can predict your pattern, and therefore I can know how much you'll be claiming from me on an annual basis. And they needed a quicker way and a more visible way into how transactions happen. And the only way that could happen is through electronic mechanism. And that's where telemedicine, from the point of teleconsultation to lab to pharmacy, in an electronic way, the entire journey provided visibility for the insurer, and hence there was a very short buy-in for them to look at Rocket Health, which is a telemedicine provider of OPD, out of patient care, as an additional on top of the traditional, and therefore Rocket Health tapped into this urban, peri-urban population that needed to buy into convenience. But also we know that insurance, not every employee has insurance, because of what Charity said. It's expensive, and not every employer has enough muscle to pay for those 1 million plus premiums for their employees. So we had to think about designing telemedicine faceted subscription healthcare plans. So it is not insurance, but it is upfront payment of your healthcare, which is quite affordable. We're talking of 100,000 Ugandan shillings per year, which allows you, because we know our population, largely young, is not going to often fall sick, but they need that one of teleconsultation of where have I missed my periods, or how do emergency contraception work, or that kind of sexual and reproductive health. If you look at a typical young population, which is not going to be bedridden, but that one of encounter that they need. So we designed packages which we called subscription healthcare plans that allow upfront payment, giving you unlimited teleconsultation, but every time you need your labs or pharmacy, you pay for them at a subsidized price. So those kind of innovations and more can come up when more players come in I think can help to pivot digital innovations in healthcare delivery.
Thank you so much. This is really maybe the last one before we go back to the plenary session. Technology is changing, right? We've had the era of computing, 3G, 4G. Now we're going into 5G, and 5G is coming with quantum computing. So don't we stand a chance of leaving so many people behind? Charity, what do you have to say about us leaving? Because we already have existing gaps in service delivery in most of these businesses catering to a segmented population, right? With the emergency of artificial intelligence, trying to understand patient populations to tailor packages or products or, points of convenience, how do we ensure that whatever initiatives we come up with are equitable and inclusive? Because if there are already gaps existing in service delivery, if we do not address them, it's very possible that this gap can widen with the emergency of the fourth era of technologies. So how do we critically think and link?
Thank you, Martin. What you've actually raised is a very, very key thing, and I think it ties on to something that Luis also talked about. Yeah, I like to say that one of the best things about the times that we're living in is it's running on data, and data doesn't lie. Yeah. So we have to really strengthen our capacity first and foremost for just basic data collection and research. Yeah. And this is where we really need these private and public partnerships to work very well, because this, I think, first and foremost, is going to be the work of our policymakers. So if we have the government saying that, in order for you to release this kind of initiative that is going to be benefiting the entire country, you must be able to demonstrate how, from data, data that we are collecting. How are you going to show that based on this data analysis that you have, that it's going to be benefiting a large percentage of the human population? So our capacity to conduct research, to collect data, to store data, and most importantly, translate data needs to be topmost. Like, that's the beginning step. And then I think, then secondly, whatever insights we derive from that, they need to be able to help us come up with solutions that can be very effective and low cost. So if you're saying that for the Ugandan population, most people are below poverty level, and we want to have as much inclusion. If you want to have as much inclusion, you want the majority of your existing population, of your existing consumer base, accessing your solution. So if you want that to happen, then it needs to be cost effective. So as the problem solver, as the designer for the solution, now that is your problem to figure out. So collectively, what do you need in order to have a very effective intervention? In order for it to be effective, it needs to be utilized by most people. And then I think in order for that to happen, we need to be able to help inform the regulatory board. How are they regulating how these processes are happening? I'm very glad that we have this new, like Louis mentioned, the organization that's going to be overseeing data protection and privacy. And I hope that there will be more initiatives like that that are overseeing how data is being used and translated by different organizations, different businesses within the ecosystem, because it will force people to think about the hard questions. And if we have regulation in place that is ensuring that the standardized ways in order for you to get certain authorization, in order to evaluate data and translate it in a certain way for you to come up with the right processes, then we'll be making, I think, a unified and collective step towards making the right step. One of the best things that come with this era that you're calling new, but it's really not even that new anymore, the fourth industrial revolution, is just big data analytics. And so anybody that is innovating to problem solve, it's how do you collect data more efficiently, and how do you then utilize that data to improve your ability to offer solutions. We have drones. Somebody brought in a bunch of drones the other day, saying, how can we just have drones help us solve the delivery of medicine to the last mile delivery of, like, intravenous or whatever it is that people within Uganda really need. So if we have big data, it will help us tackle supply chain issues, will improve logistics issues, will eliminate a lot of the barriers that are existing. But most of that is going to depend on our big data analytics, our big data storage, and our how we collect that data, storage, translate it, and utilize it to improve all of these facets. And maybe to close, just as I answer this question, and I want to re-emphasize what Louis really talked about extensively. We're going to have so many stakeholders coming together to just formulate high-level strategies. This strategy is not going to depend, the most effective strategy will not be dependent on me as an individual who is trying to solve the problem. I can be brilliant, like the team at TMCG, and you have all of these things that you need to do. But if you don't have a national digital health strategy, which has a very clear vision on how these technologies should work, I think it's going to be very difficult. So if we have stakeholders coming in from government level, from funding level, just at a national level, all these stakeholders coming together to design a digital health strategy, or something that makes sense for all, everybody's just going to be sort of trying and failing, doing this, will it work, will it not work, what challenges will come up? So I think that would be a very core beginning step, that anybody that is watching this, anybody that is listening, from government to funders, all the stakeholders that can help us improve innovation in healthcare, if you can come together and come up with a high-level strategy that can guide all of the instruments that are going to be in play going forward, I think that would be an amazing starting point. Thank you.
That's quite interesting. So the couple of things that have come out of this session, and I really hope that we can share them. What we intend to do is not to have just a discussion, but to actually get a policy brief from each and every session. And we shall send it to you guys to review and the attendees, so that we call who we said are the big people in the room, the government. You know, what COVID has revealed is you've had these conversations redundantly and nothing was done. And then all of a sudden, what should have been activated was, haphazardly taken up. Government wasn't understanding how digital technologies work. They tried to replicate things themselves instead of going out and say, hey, Charity, can you build capacity for our people on ground in community-based care? Can TMCG take on the calls? So they went to MTN, outsourced things. MTN having a call center doesn't mean they have the clinical expertise to manage a medical crisis, but outsourcing a service like that to TMCG would have made their work so easy, because TMCG knows who to recruit, how to maintain, how to, to scale. Charity knows how to understand customer experiences. How do I build capacity? How do I create solutions by thinking through them rightfully? So we want to take feedback from this session to the stakeholders, and that will be in a brief from this session. And I will share it with you before we share it to them, such that, there's tangible outcome from discussion and them just being conference discussion, and that's it. So we are mandated to the attendees and these panelists who have graced us to actually make tangible outcomes of this session, and this will be shared. So I thank everyone who has made it to this breakout session. We are going to be having another session going on with the World Bank. They have some interesting presentation to make at 2. Right now, there's some other interesting innovation that are going on in the plenary. So I have shared the link in the chat. If you can look at it, please feel free to jump back into the plenary session. But otherwise, thank you so much to everyone who has made time, and we end this breakout session. Thank you for making the time. I know Chaz is very busy. Lou is very busy.